My name is Wayna Gerhardt, and on May 7th of this year, I was diagnosed with colon cancer and referred to Dr. Tahil Rahmani at Chesapeake Regional. I went in for a standard colonoscopy. It had been due the 2020, and because of COVID, it had been postponed. And I was referred to a new gastroenterologist, Dr. Mindu, because mine had retired. She did the colonoscopy on May 3rd and said that she had a large polyp, or I had a large polyp that she couldn't remove, and she was going to refer me to a surgeon. I thought something might be up, but we didn't find out until May 7th that it was actually malignant. I felt like my world was coming to an end, but that we needed to just deal with what was presented to us and get it taken care of as quickly and as professionally as possible. Dr. T's office was magnificent. She spent, I would have said, an hour and a half with us. I know it was more like 20 minutes. She drew pictures. She explained exactly what was going to happen and connected us with her scheduler, who is Luann, and Mindy, her nurse. And from there on, the three of them together were able to answer every question that I had at any time of day. No matter how minute, they acted like it was serious business and they calmed me down, which is what I needed, because I'm trying to stay brave for the family, and meanwhile I'm falling apart inside. So from the moment we met them, it was obvious that they knew what they were doing. They'd done it several times before. They answered every question. Like I say, pictures, diagrams, we had it all. And I left there feeling very confident that whatever could be done would be done, and not knowing what the outcome would be and knowing that they had no control over that, but they were going to do their best. I was totally amazed in pre-op because every single person that came in or that was in the OR when I was wheeled in, regardless of what their job was, came over and introduced themselves to me and told me who they were, what they were going to do. They didn't bring the robot over and introduce it to me, but I could see him at the end of the room. But that just gave you a feeling that you were an individual. You weren't just the next patient that they rolled in. And that kind of calmed me down. And you know, you're scared. You're scared to death because you don't know what's going to happen. You don't know what you're going to find out when you wake up. So to know that it felt like they cared made all the difference in the world. I woke up in PACU, magnificent nurse there, and she got me transferred upstairs to 5 East, to Brenda, who was the nurse that signed me in. It was change of shift, and Brenda stayed over past her change of shift to get me settled, which was above and beyond. The incoming nurse was there, and he could have taken over, but she said, I started it, I'm finishing it, and that's just the way everybody behaved. I don't think I've ever been anywhere. I know for a fact I have never been in any physician's office or, medical facility where somebody didn't say, that's not my job, I'll go get whomever. Not to be mean or anything, but just because they don't do that. And I did not hear that one time at Chesapeake. No matter who came in to the room, the last question before they left was always, can I do anything for you? So, I mean, that's just, to me, a sign that people are working as a team. And if you do that, it's a whole lot easier on everybody, I think, and particularly better for the patient. They knew me as an individual, and I mean, I was only there 2 nights. So it wasn't like I was a long-term care patient that they had, weeks to get to know. And that's what impressed me. I mean, if somebody's, only there 2 nights and you still know enough to remember who was there with them as a family, you're paying attention. And while that may not have been a medical necessity, it certainly was a mental necessity for me to know that these people cared about me. And that, if you know you're being well taken care of, you relax and you heal a whole lot faster. I'm feeling good now in that they feel that they got all of the cancer. I'll be monitored for the next several years to see if there's any recurrence, and we're keeping our fingers crossed. As nice as everybody was at the hospital, I really don't want to see any of them again, at least in that setting. I wouldn't mind seeing them outside the hospital, but I don't want to go back to 5 East, okay? I would highly recommend Chesapeake Regional to anyone that needs medical care, be it acute, be it voluntary. That's where I would start. there's a difference between being medically proficient and being a good care team. It's not automatic. My mother was an RN back in the old days. I mean, with the the capes with the red lining and the blue wool on the outside. And she left nursing for a while when all the computers came in, because she said they're not nursing, they're running machines. And that was not the case at Chesapeake. Those were individual nurses who knew their patients and cared for them. But you want to do well when people are caring for you that much. So you don't want their efforts to have gone to waste. So if I had to have this happen, I couldn't have had it happen with better support than I got from Chesapeake.